State and city leaders hope to speed up the painfully slow process of distributing the COVID vaccine.
We could soon see much larger clinics for the groups eligible for the shot. More than 46,000 people statewide have already received the 2 doses. In Denver, though, the number is only 9,500. But these numbers are expected to increase in the coming weeks. We saw the big drive-through testing sites at the start of the pandemic. Now we'll see something similar for the vaccinations, although maybe not quite on that scale. The clinics will be run by independent healthcare providers with an assist from the city of Denver. CBS 4's Karen Morfitt looking into the effort. Karen, a big hurdle will be finding enough people to administer the shots.
That's right, Jim. I mean, there are a number of hurdles. Finding space is one of them, but that can be solved with something as simple as opening a large parking lot. Having enough hands on deck, not as simple. Now the state is saying they are going to widen the scope of practice for a number of healthcare professionals to try and fill those gaps.
As plans ramp up for providers to host more large-scale vaccination clinics, the focus turns to how.
If we move our clinics off-site, we're definitely not going to have the staffing internally to do that.
John Sanesteven is the CEO for Salud Family Health Clinics. Their goal is to get as many vaccines into arms as quickly as they can.
We can do 160 individuals a day per clinic, so we're hoping that we can at least triple that.
But mass vaccination clinics like those seen in California don't just mean more space, they mean more help as well. Salud has been advocating for changes to some of our state licensing requirements to help fill the gaps.
If we could have an expanded pool of professionals that can help us with the vaccination, that would be great.
With the governor's approval, the Colorado Department of Regulatory Agencies has now issued emergency rules that would do just that, expanding the scope of practice for a number of professionals and allowing temporary licensing to some, among those physical therapists, podiatrists, chiropractors, and others.
With Salud, we have 18 dentists that are willing to help us vaccinate patients and citizens, so that would be fantastic.
While Sanesteven says the vaccine itself has been limited, they're preparing for everything.
We want to make sure we're ready to try to have these large clinics when that happens.
Now, we do know that UC Health is planning to host a large vaccination clinic sometime toward the end of January. They expect to be administering about 5,000 doses per day. They will also be partnering with Salud to help get their plans for larger clinics off the ground for some of our underserved communities. As far as dates and times and where those might be, those haven't been released yet, but as soon as we have that information, we'll be sure and update you. In both instances, we do know an appointment will still be needed. For now, we're live in Denver. Karen Morfitt covering Colorado First.
All right, Karen, thank you.